So, if a patient comes to you with pain in their abdomen, you're going to want to assess bowel sounds. Bowel sounds are the intestines pushing food through the GI system through peristaltic action. To assess this, you're going to use a stethoscope and assess all four quadrants. Sometimes, if you just want to use the lower right quadrant, that's fine too. You're going to listen for clicks and gurgles for around 5 to 34 times per minute. And if you don't hear anything for 3 minutes, you're going to want to refer to a physician.